everybody for joining us today for the memo writing competition. We have some great memos written by some great students of ours in a lot of different topics, and I hope you guys really appreciate the fact that they were taking a really broad issue, a stance, and trying to be persuasive in only one page. So they really wanted to get to the meat of their argument, and they created these wonderful memos which they're going to present to you today. So, for our first person, we have Sydney.
Hey everyone, my name is Sydney Simpson. I am a fourth-year student in the Department of Microbiology and Immunology, and my memo presentation is based on Bill S2161, Assembly Bill number A833A. I am presenting to the New York State Speaker of the Assembly, the Honorable Carl Hastie, as one of his staff members. Briefly, in the wake of the opioid epidemic, New York State continues to expand access to life-saving medication-assisted treatment, or MAT. Yet, despite having an increased incidence of substance use disorder and risks for overdose following release, incarcerated individuals remain largely uncovered by current laws. This bill seeks to create individualized MAT programs for inmates in all New York State facilities, including county jails and state-run prisons. And although costly, it would be effective in preventing relapses, overdoses, and repeat incarcerations. The United States is in the midst of an opioid crisis, and New York State is no exception. Current legislation focuses on increasing resources and access for the general population to opioid treatment programs, including MAT, medication-assisted treatment. MAT combines behavioral therapy, 3 different FDA-approved medications, and counseling, utilizing nurse practitioners, counselors, therapists, and psychiatrists. It's considered to be the gold standard of treatment by the Substance Abuse and Mental Health Services Administration. And in the 2020 fiscal year, the Office of Alcohol and Substance Abuse Services has budgeted $200 million in New York State to increase resources to MAT. However, only $3.75 million of this will assist individuals in prisons. This is despite the fact that 75% of incarcerated individuals meet the diagnosis criteria for substance use disorder. They're 129 times more likely to overdose in the 2 weeks following their release than the general population. And despite all of this, only 6 of the 54 state correctional facilities offer MAT, along with a handful of county jails which have created partnerships with local opioid treatment programs. Ironically, the Rikers prison complex in New York City has the oldest opioid treatment program in the country and has shown success in decreasing relapse and reincarcerations following this treatment program. Individuals suffering from substance use disorder undergo a vicious cycle of addiction, which leads to criminal behavior often related to procuring drugs. This leads to incarceration. Following their release, they relapse and continue the cycle. However, studies at Rikers as well as other institutions have shown that with drug treatment, particularly with the combinatorial nature of MAT, that individuals are able to undergo long-term recovery and get out of this cycle. MAT in prison leads to decreased recidivism as well as decreased rates of relapse and reincarceration, and causes decreased overdose and relapse following re-entry into the general population. In brief, this bill has 3 main mandates. It wants to implement individual-specific programs in all jails and prisons across New York State. These programs will be catered to meet individual needs and include complex re-entry programs into the community, such as assisting individuals with applying for Medicaid, as well as setting them up with treatment programs for when they return to their communities. The standard of these programs will be set by the Commissioner and the Office for Alcohol and Substance Abuse Services. Second, all of these programs will be funded by New York State. And finally, inmates who are qualified and diagnosed with a substance use disorder will be able to opt in at any time during their incarceration. This bill passed the Senate in the past legislative session in June 2019. However, it was unable to pass the Assembly and has undergone revisions. Opponents of this bill cite that it will be very resource intensive as MAT is catered to individuals and utilizes a team of medical professionals. Additionally, it will require large amounts of oversight in order to implement correctly. Thus, we have a few policy alternatives. One would be to pass it in part, keeping reentry strategies. This would utilize resources available to the general population in the community. Current legislation that have been passed through the Senate and the House include Senate Bill 9535, Assembly Bill A7246A, which increases insurance coverage, including Medicaid. So through this reentry program, individuals who are eligible for Medicaid would be given assistance in applying and then set up with opioid treatment programs in their communities following release. Another option would be that there are current pilot programs, such as one at the Elmira Upstate Correctional Facility, which allow individuals who have started MAT treatment at Rikers and are transferred to upstate facilities to continue their treatment, thus preventing them from having to go off treatment while in prison. And finally, another option would be to create programs at a select division of correctional facilities. This would allow us to maximize our resources based on need, as well as what resources are available to those correctional facilities, and county jails would still be able to set up partnerships in the community to create their own programs. These options can be defined as basically that the more people we give access to treatment, the more expensive it's going to cost. If we pass this bill in part, focusing solely on reentry programs, it'll be the least resource intensive, as it'll utilize resources that are already available for the general population, but won't help individuals while they are incarcerated. By expanding pilot programs, such as the one at the Elmira Upstate Correctional Facility, will only help individuals who are already receiving treatment, as well as likely only individuals already at Rikers. By passing it at select correctional facilities, this will only assist a limited number of individuals, but would maximize resources based on need, as well as what areas are available, and still let county jails to set up their own programs. However, if we want to really allow everyone to have access to this life-saving treatment, we need to pass S2161B, Assembly Bill A833A, which will provide access to MAT to everyone in need, and is the only one of these options that would include county-run jails. Thus, my recommendation is that this bill should be given priority and put on the floor before the Assembly in the upcoming legislative session. My reasoning for this is that while it is expensive, it has been shown to be highly effective. And New York State continues to pass legislation that increases resources only for the general population. This doesn't cover the incarcerated population, even though they've increased risks and incidences of substance use disorder. And also, with successful treatment, individuals will be able to break out of the cycle of repeat incarceration due to addiction and relapses, thus lowering the cost over time and potentially saving the state money in the long run, as fewer individuals will be in our prisons and jails. And with that, these are my references, and thank you.
Questions?
Rohit?
Do you know what's going to happen to the Rikers program as the mayor and others try to close the Rikers Island facility?
Well, if the facility is closed, the program will stop, because currently it is funded through New York City as well as through select agencies. They might be able to, they'll have to send that population somewhere, so it might be able to continue. But if this bill is passed, they continue to have access to any care they already have. Yes, Scott?
You mentioned the cost. Do you have an estimate of what the cost is?
No, I do not have a current estimate. They're unsure how much it'll cost based on how many people will indeed use the program. I can tell you right now, though, that New York State has the highest cost per inmate out of the United States. The average in the U.S. is $33,000 per year. New York State is averaging $60,000 per year. So ideally, some of this cost could come from other programs in the prisons.
And was there a proposed timeline for implementation?
Yes, after this bill is passed, there's a proposed timeline of the commissioner will have 120 days to come up with standards for this program, and they will then be implemented. It didn't estimate how long the implementation timeline will be based on what community jails are able to do, and as well as prisons.
People are in jail for various lengths of time, so is there a certain amount of time that someone has to be in the program for it to be effective?
No, there have been some researches done at Rikers, though, that show that if they manage to start individuals right before they leave the prison, that they still do have increased rates of overdose and relapse, but not as much as if they don't start it. The issue with that is also that they haven't really been able to, it's unethical to utilize some of those controls, such as by not letting people who want to receive treatment in prison receive treatment. Yeah,
When you
Tracy?
say proven successful, could you give some estimate as to what that success looks like?
I can tell you that Rhode Island has already implemented a bill like this, and all jails and prisons in Rhode Island now are required to have MAT programs, and they have seen that for every 11 individuals treated, they prevent 1 death from overdose.
Thinker speaker again.
Sorry. Okay. Hi, my name is Rohit Pali. I'm a student in the biophysics program, a 4th-year student in the Takar lab. I'm going to tell you about health policy reform in the New York Health Act. So this doesn't click. So this is addressed to Senate Majority Leader Andrew Stewart Cousins, because this bill has passed the Assembly 4 times and has never been brought to a vote in the Senate. And first, I'm going to start just by talking about the current health system. And this, on the right, I'm showing a chart of the percentage of uninsured and the estimated impact on mortality in multiple states and the country as a whole. And people think of New York as a state that has lots of insurance coverage, but nonetheless, about 1,400 people die every year just from lack of coverage to begin with in our state. And even those with insurance often can't afford it. On the right, I'm showing the change in percentage of people whose health costs after their insurance is kicked in, so their co-pays, deductibles, and out-of-pocket expenses are more than 10% of their income, or 5% of their low income. And that number has grown from early in the century, only 9%, to 23% across the country. So in New York State, there remain many people without health coverage, and about 1/4 of the people, even that do have health coverage, can't actually access the health care that they need. And this is really important because healthcare is a human right, and it's both in the Universal Declaration of Human Rights here from the UN, which unfortunately the US is no longer a party to as of a year ago, but it's still an important benchmark, as well as the New York State Constitution, which states that the government must provide for the protection and promotion of the health of the public. And so to address this, we have a couple of policy options. We can stick with the status quo that's leaving a lot of people without access to health care. We could add a public option, which would provide a competing government plan, or we could implement a single payer system in which the government provides health care for all individuals in the state. And so the current health system is built like this. The financing of it is built like this. The government, businesses, and people provide money to health insurance companies who pay doctors' offices and hospitals, but waste a lot of money on administration, both at the doctor's offices and billing, and at the insurance company in marketing, profits, and labor costs. But individuals still end up having to pay money each time they go to the hospital or go to see a doctor. But this system does have its pros. It's what we have now, so it's not disruptive. It does serve, 94% of people are covered, and 3/4 of those people can usually get the health care they need. And it produces excellent outcomes for the most affluent in our society. But there's a lot of downsides. There's restricted access to care. Coverage is based on employment, which sometimes restricts people's choices of where they work. It creates a lot of health inequity. People who are on Medicaid often wait twice as long, for example, to get a new patient primary care appointment or to see a psychiatrist. And there's a lot of administrative waste from dealing with different insurance options. The doctor's office or having to argue with the insurance companies, and from just filling out all the different billing paperwork to begin with. And finally, this system has induced a great deal of health sector cost inflation, and that inflation did go down after the implementation of the ACA, but it has continued to be higher than the rest of the world. And there right? And so one consideration is how to stop that inflation. So the public option would work very similarly to the system we have, just there would be one public plan in addition to all the private plans that would also take payments from people and the government and then pay hospitals. And because it would be administered by the government, it might have less of a profit motive and end up bringing down prices through competition. But unfortunately, we've seen that, and so the public option does have a lot of pros. It maintains insurance without disruption, and because it can bring costs down a little bit, the premium costs down a little bit, it covers nearly everyone. But we still have the inequities with Medicaid, we still have administrative waste, we still have health sector inflation, and the cost to the public of funding this public health insurer will go up over time due to lemon dropping and cherry picking by insurance companies. So what happens is the insurance companies keep only the healthiest people in their plans, and so they'll kick out anyone who's sick and they'll only take people who are particularly healthy. We have evidence that this happens from the Medicare Advantage program. So in Medicare, which is a public program, there are these Medicare Advantage plans that allow people to purchase private coverage, which expands their coverage a little bit, and is supposedly better. And it is better for those people. But the key to health insurance companies making money off of Medicare Advantage is that they cherry pick the healthiest patients, they get rid of the sickest patients, and they manipulate the data to make it look like patients are healthier. So what's relevant for a public option is that they would cherry pick the healthiest patients and kick out the sick patients so that the public option would have to take care of those people and increase costs of that. And there's a lot of data to show that this is true. So this is the health expenditures in the year before entering a Medicare Advantage plan. So if someone switched to Medicare Advantage the next year, they were likely healthier and cost less money for the healthcare system in the year before they switch. And the same is true in the opposite way. That after, so this is stayed at a nursing home or not, and this is, blue is switched from traditional Medicare to Medicare Advantage, or to Advantage, and green is switched from Medicare Advantage back to traditional Medicare. And you see that through clever designs, irritating people, they've convinced all of the sick people to switch out of their programs. So there is a better way that doesn't have this problem. And that's to put everyone in a single government plan that takes care of all of us when we're sick. Businesses, it's simple. Businesses and people make an income-based progressive premium to the government, which funds a health insurance plan, which pays for us to have health care. The benefits are numerous. We create health equity. Everyone's on the same plan. Doesn't matter how rich or poor you are, you get the same health care. There's less administrative waste because you're not dealing with many insurance companies. There's democratic control of the health system so that we decide instead of bureaucrats at either insurance companies or hospitals. It uncouples employment and coverage so that people can work wherever they want and still get the health care they need. It reduces health sector inflation since this government plan has the purchasing power to negotiate with hospitals and lower their rates of increase in costs. And 98% of New Yorkers would pay less under this plan. There are some cons. It would cause job losses to the insurance company workers who didn't do anything wrong. They just wanted a job. But that's in this bill that's provided for by extended unemployment insurance and job training for them. It's highly disruptive. We would have to redo the financing system basically from scratch. And there would be a nominal increase in taxes even though costs would go down. And so in summary, we have three policy options: to maintain the status quo, which has health inequity and administrative waste and continued cost inflation, but it's what we have, so it wouldn't be disruptive. We could add a public option, which wouldn't be very disruptive. It would have a little bit more health equity because more people would have access. But we'd still have administrative waste and cost inflation. Or we could pass the New York Health Act, which would provide us an equitable health system with little administrative waste and finally control the inflation of healthcare costs. but it would be highly disruptive. And so my recommendation, of course, is to go with the New York Health Act. Thank you, and I can take questions.
What would you do for public employees? So we at City Hall, we have retirees who move out of state that we currently pay healthcare for. What would happen to retirees that worked in a public system in New York State but then moved out of state?
Yeah, so we would contract, we would contract with so the way it works now, if you have health insurance, say from Blue Cross Blue Shield here, Excellus, then if you went to Florida and got sick and went to a hospital there, they have it set up so through the Blue Cross Blue Shield system, the Blue Cross Blue Shield of Florida pays for your care, it gets reimbursed by Excellus. So we would do the same thing where we would contract with one of the major health insurance providers around the country so that they would pay locally for your care and then New York State would reimburse them instead of Excellus reimbursing them. Oh, go ahead.
So if it was healthcare for all and it's supposed to be equal, how would the payment work for the individual? Would it be percentage based or does everybody pay the same amount?
Oh, no, it's free at the point of care. And the reason for that is that there's been a lot of careful study done around this. Basically, as you increase costs at the point of care, so what you're talking about is co-pays or co-insurance, so co-pays are flat, co-insurance is the percentage. Co-pays and co-insurance, as you increase it, people decrease the care they utilize, but actually the rates of care utilization for needed and unneeded care are the same. So people are very bad at distinguishing whether they need to go to the doctor or not, and if you increase the cost, they just won't go even if they need to. And so like triage nurses and education are much better at reducing unneeded care. So,
How would that affect New York State then? Because New York State has a lot of the big, like, neurodegenerative research, so a lot of people move here with those diseases. So would the cost be more expensive for their healthcare?
well, where?
So like you're saying it wouldn't be like an additional cost for the person, so it would be the state who takes
Yes.
the cost? So a lot of people move to New York because it's a big MS study here. So like all the big doctors here.
But they're getting paid, their care is already being paid for as part of the system here, just through Excellus.
Okay.
And by recapturing the money that's now going to Excellus through this income-based premium, it'd be the same amount of money on either side. Now, there's an argument to be made that new people want to move here that aren't here yet for that because there's free healthcare here. But when there's two pieces of evidence that would happen. The first is in Canada, they went province by province, and you didn't see people move to provinces that had implemented free healthcare. And then second, when Medicaid expansion happened, the people in that Medicaid expansion block, in that income range, didn't move to Medicaid expansion states in order to get free Medicaid. Yes.
I'm wondering about the comment if this will be administrated by the government. Where will these people be coming from, and don't they need to be trained as well? And what about government turnover?
And that'll be more efficient.
Okay, so
Same questions here.
so these are interesting and important questions. There's people who would come from, hopefully both from the CMS, and from the health insurance companies that currently exist in the state, so the ones that have experience dealing with these issues. And the evidence we have that would cost less is that Medicare and Medicaid cost less, and most estimates use 6%, which is the overall Medicare number, but that's actually very high because the Medicare administration percent is only 6% because of the Medicare Advantage plans. So if you look at traditional Medicare, it only costs 2% to administer. And so we're even accounting for 3 times what Medicare costs to administer.
Part of that question, though, is I think so. The state is just frankly notoriously bad at administering programs. So with HCR, if you want to make a rent adjustment payment, waiver, it takes about 3 years for them to do. The state just had, I think they overspent on Medicaid by $4 billion. So a lot of the reason we in government go to the private sector for things is because they can do it cheaper and more efficiently and frankly just better. So do you really think the state of New York, because we only get one shot at this, right? And it's going to be a model for the nation, and I'm just playing devil's advocate because I support it, but do you really think the state prepared, the state bureaucracy in Albany is prepared to adequately run people's health insurance?
Thankfully, it wouldn't be the same bureaucracy. So we're creating a new structure with new appointed officials and local elected boards. But
So maybe.
Right, let's take our speaker.
First off, can everyone hear me just fine? Okay. So I'm Nick Battaglia. I'm a fifth-year student in the microbiology and immunology program, and today I'll be talking to you about municipal broadband, specifically addressing Mayor Lovely Ward. So before I get into this, I don't think I really need to explain to everyone here how important internet is in our daily lives. You need it to do work, you need it to find work, you need it to apply for jobs. It's incredibly important. Now, in New York State, access to broadband internet in terms of a physical sense of fiber available throughout the state is not really a problem. With current initiatives, we'll have around 99% of the population with access to fiber internet. But the problem here comes from financial hardship that actually limits access to people paying for a service. So, in an NTIA survey, it found that around a quarter of families that do not have internet and have incomes lower than $25,000, about 32% of them cited high cost of internet service as a reason that they do not have internet service. Now, if we look in Rochester, the median income is around $35,000 annually. And if you look at income earners less than $25,000 per year, around 40% of the city takes home less than $25,000. So obviously we have a large population here that can be affected by financial hardships, especially in regards to acquiring internet service. Now, additionally in Rochester, we have this map here. So what you're seeing here is in the lighter blue, this is areas where you have one broadband provider that's fiber-based, whereas in the dark blue areas you have two providers. What you can see is firstly, west of the river here, there's only one provider. So why is this problematic? Well, competition generally drives down prices enormously. So just an anecdote, I used to live on Elmwood Avenue where there are currently two fiber providers. There I could pay $30 a month for 400 megabits per second down, or $50 for 500 megabits down. Currently I live on East Henrietta where there is only one provider in my area, and I can pay $50 a month for 100 megabits per second down. So you can see how drastically speeds increase and prices decrease when you have competition. And again, so we see there's large swaths of Rochester that only have one provider. So how does that affect our actual percentage of households with broadband internet? What you can see here from the US Census Bureau is that Rochester is actually lagging behind national averages in percentage of households with broadband internet. So the question is, how do we solve this problem? Well, given the name of the talk, I would suggest municipal broadband. So municipal broadband is where a city or municipality offers either full service or partial service through laying lines and then either providing internet service itself or allowing private providers to lease the lines. So it can be offered through a number of ways. You can use Wi-Fi access points, 5G wireless access points, or fiber. So obviously these are all viable options. Which one should Rochester go with? Well, I will just let our mayor tell you herself.
Our city is crisscrossed by an extensive network of fiber optic infrastructure built over decades by Monroe County, the city of Rochester, and private telecommunication partners.
So in Rochester, at least as of 2015, the most recent statistics I could find, we already have 360 miles of fiber cable laid, and by the worst estimates, only 30% of that capacity was being used. So we have an abundance of fiber optic cable, and this is increasing normally through routine maintenance of sewers and other utility lines. And interestingly, New York, unlike other states, does not have any laws limiting deployment of broadband by municipal governments. So what are the benefits of municipal broadband? Well, as I said, competition tends to drive down prices, and generally, even without competition, municipal broadband tends to offer cheaper prices. So here you can see a graph of what we're looking at here on the x-axis is megabytes per second per dollar. So basically higher is faster internet for less of a cost. And here we have two big private services that offer internet, Comcast and Verizon, and all the rest of these are municipal-based broadband providers. What you can see is that for the most part, they either match or exceed these private services in megabits per second per dollar spent. Additionally, numerous cities that have municipal broadband have cited that the service actually attracts businesses to their area and increases venture capital in the local area. And furthermore, this then can, with the use of venture capital, increase startups that are funded by increased venture capital. And a big concern about municipal broadband is we're adding another service that a municipality has to sort of govern, administrate. What are the costs associated with it? Will it be profitable? Well, so far, when you average municipal broadband services already available, the take rate, which is the amount of consumers that actually apply for the service versus the total consumers in a given area, you can see that it's 54% across these municipal broadband providers, and this is much higher than is necessary for the break-even profit zone for fiber optic networks, which is around 30 to 40%. So in summary, in Rochester specifically, we have high costs of private sector internet and limited competition that makes it harder for lower income families to actually afford broadband internet. We also have an existing infrastructure that we could take advantage of to employ municipal fiber, making it a lot cheaper to get into this business. And lastly, municipal broadband is cost effective, it increases competition, it's good for consumers, and it attracts business. So with that, I will take any questions.
So I think there's a few issues here, right? So there's the fiber that exists and just isn't being utilized, and I could go off for hours about this because frankly the county owns a lot of the infrastructure. We've been approaching them for 3 years. We did a study with Magellan that showed how much fiber they had, showed the benefits it could have for business, and they just didn't feel like working on it. So hopefully with a new administration that'll change. But I digress. Two of the, there's always two components to connecting to the internet, right? There's the broadband access, but then there's having the device. And so do you know of it was around 35% of households in the city didn't have access to broadband, but do you know of that 35% what the access to a device is? Because it's kind of...
When you say a device, do you mean like a modem or a computer?
A computer, a laptop.
So I don't remember for the city specifically, but generally nationally, it's around 80% of households have a computer, and I don't think internet access lags much behind that. So if you have a computer, you have internet access.
That's just an added cost for people if they don't have one.
But wouldn't there also be benefit just for people who have phones to have access so that they're not having to use data and they can access the Wi-Fi?
Are you saying in terms of setting Wi-Fi networks
well,
up?
Asking what percentage of people have access? I think it'll benefit anyone who has a phone too. That's what happens on their internet.
I don't know numbers, but I thought Rochester has a very high population of poverty compared to the nation, so it might not be comparable. And then the idea of what type of low cost of the internet, whether or the municipal broadband, for people to actually even go into the low cost one. Like how low would that cost have to go in order for those people to decide that they were going to purchase?
Yeah, well, so I don't know statistics on like how low the price has to be for usage, but one of the things that I think a municipal service could offer, because they're not as driven by a profit motive, is the sort of lowest tier of service that you can get. So right now through Spectrum, the lowest service tier you can get is 100 megabits per second down, whereas broadband is defined as only 25 megabits per second down. So you could offer lower tiers of service that are costing much less.
Because I like your idea of the competition, but in terms of all population having access, I didn't know if that would be possible really.
Possible in terms of
in terms of the lowness of the cost, you'd probably still be missing people, but I don't really know.
So what's the next step to implementing your recommendation?
Well, based on this, I would say talking to the county to actually get those lines in use, because most, as I said, most of the costs from deploying broadband through fiber is the laying of the fibers, so I don't think that's a major concern. And mostly these municipal broadband services have been administered by existing utilities, and furthermore, they're not funded through increases in taxes normally. They're normally done through revenue bonds, which pay themselves off over 20 years or so. And many existing municipal broadband service providers have actually exceeded projections for profit, so I don't think there's much of a financial issue once you consider all the factors, especially in Rochester.
And there aren't really any sustainability costs that
No, generally they cover their own operating costs.
So are you defining municipal broadband as, so for example, is the city owning the infrastructure but then working with a private company to provide the service and maintain it, or is the city going to bill someone for internet just like we bill for water service, or would that be done through, say, Greenlight or Spectrum?
Yeah, so you could do either or option, or you could do both where the city offers its own service but then also leases the lines. Preferably, I would want the city to offer its own full service and bill customers directly, because I think there's still less profit motive there, but either option works, or a mix of the two.
There are areas of the city that aren't covered, period, right? So there's issues that we have with the county. So for example, downtown is actually a double redundancy versus in all of downtown, which could really attract, especially some of the startup companies and the high-tech companies that have moved downtown. That's just a matter of activating it. But as far as actually building the infrastructure in some of our neighborhoods, we did an estimate at what it would cost for us to do it in one shot, and it was around $200 million. I mean, it's a very steep cost, and it's nobody doubts the efficacy of having broadband, but if we had $200 million to spend, do you really think that would be something that people would want us to spend to get broadband access versus new roofs for people and some of the other, affordable housing and some of the other priorities that are so pressing for people? Do you think that large of an investment, would that be worth it?
I don't think it would be worth it just right off the bat, but I think you could start offering the service and then expand it as its profitability increases over time. So then it's less, direct cost to the city and more just revenues from the service itself paying for it, for an expansion.
So part of the proposal, right, is to incentivize competition. You can certainly do that through municipal broadband, but if that's such a steep cost, aren't there alternatives in which the city or state or county could incentivize someone like Greenlight to develop in more areas to create that competition without all of the steep infrastructure costs of setting up a city-owned network?
Yeah, you could do that, but we have done that as New York State. We've paid private providers to expand their broadband networks, and they've been reluctant to do so. And even when they do that, I mean, I'm sure people who subscribe to Spectrum will have remembered, a couple dollar increases in their price when New York State sued them for not meeting the criteria of their expansion. So I think it's fraught with a lot of problems there.
Do you think that, I don't know about, so I guess I'd put it this way, do you think that the cities that have municipalized broadband, so the other cities are comparable to Rochester in their rates of poverty? That is, like, if it was in fact profitable, I imagine.
Yeah, I mean, it's not, I don't know offhand, but they're not necessarily all large cities. Like one of the big examples is Lafayette, Louisiana, where I don't know how many of you have heard of that city, but it's certainly not a large city, and Louisiana is generally an impoverished state, so. Sorry, go on.
Lafayette's a college town.
That's true.
Wait, so it's Rochester?
Yeah.
Okay, let's take our speaker.
So, hello, my name is Janelle Beasy. I'm a sixth-year student in microbiology and immunology, and I'd like to share with you a memo concerning the recent animal resource recycling program and their green initiatives. So the University of Rochester has a very clear commitment to being a leader and promoting a sustainable society. They've recently demonstrated their commitment to this by enacting a green initiative in the Animal Resource Department, promoting recyclable gowns and gloves. However, in their enthusiasm to recycle, it's promoted a switch from reusable gowns to ones that are single-use, and therefore the switch needs to be reevaluated, especially because reusable gowns outperform the disposable in terms of cost, performance, and their environmental impact. And therefore, I recommend that the University of Rochester should honor its commitment to being a leader in sustainable practices by returning to multiple-use gowns. So currently, the recent initiative has been pushing to reduce the amount of waste by eliminating shoe covers in the KMRB. We've switched to recyclable gowns and gloves, and they are moving towards recyclable hair nets and face masks. And by and large, these efforts have been fairly successful in terms of promoting reduced environmental impact. However, as I mentioned, we've now skipped this key component of the energy hierarchy of reusing and move straight to the more recyclable gowns and gloves. And because we've skipped this component, I think this policy and this initiative needs to be evaluated more closely. Especially because in the switch from reusable gowns to disposable, we've also made an additional switch where the reusable gowns were opaque, and so we're able to double as a cover for cages when you're transporting them out of the vivarium. And the current disposable gowns are see-through, and so are not able to be used as a cage cover. And the solution to this was to provide brown paper bags in order to use for cage covers. And while these bags are also recyclable, again, it would be better to just eliminate that need for that waste in the first place, and therefore returning to the reusable gowns would eliminate both the gown waste and the paper bag waste. So the main concern, again, is this increased environmental impact of the disposable gowns that are currently being used, both for their direct and indirect increased impact on the environment. So as I mentioned, the direct gowns, the direct impact is that the single-use gowns are generating more waste and consuming more resources, especially when you consider the lifetime of the production and use of the gown compared to the reusable ones, as well as the indirect cost by switching to the disposable gowns that are too transparent to use to transport cages, and therefore resulting in an increased paper bag waste as well. So the reusable gowns are outperforming the disposable in terms of cost, performance, and environmental impact. So in terms of cost, over the lifetime of the gown, reusable are more than 50% cheaper when you consider the production and the amount that you pay for the gown, and when you consider how many times you can wash the gown. The reusable ones can go down to under 10 cents per use, as opposed to the disposable, which are closer to 50 cents per use. And in terms of performance, which is another important consideration for any purchasing decision, the disposable gowns are very thin. They do not provide an effective barrier, which when you're dealing with animal waste is another important consideration. And then as mentioned, the environmental impact, where a recent study was conducted across many different universities who are using a mix of either the disposable gowns or the reusable gowns. And they found that across the board, reusable gowns are reducing non-renewable energy consumption, global warming potential, and water consumption by roughly 30% compared to disposable gowns. And then also, as mentioned, the reusable gowns are able to double as a reusable cover when transporting cages, so therefore decreasing the amount of waste that we're generating there as well. So I recommend that the University of Rochester should return to the more cost-effective, better performing, and environmentally friendly reusable gown system. And that would also be able to allow the university to return to the reusable method of transporting cages, or covering for transport of cages. And that this would help the university be able to adhere to its standard of being a leader in promoting green initiatives. And due to the cost savings that I mentioned before, making the switch back to the reusable gown system would help the university save a little green as well. So I would be happy to take any questions. Thank you.
Is there a higher upfront cost? Is that part of the issue of why it hasn't happened so far?
Why we haven't gone back?
Yeah.
So in order to go back, there is a higher upfront cost because the initial purchasing of the reusable gowns is higher than the cost of an equivalent number of the disposable gowns. So if the gowns that we used to have no longer, if they have been gotten rid of since we've made the switch, then I think there would be an upfront cost again to be able to return back to them. If they're just in storage somewhere and we can pull them back out, then the upfront cost would not be nearly as high. Yes.
Yeah, so I'm Jeff Wyatt, so thanks.
Yes.
One reason we made the switch is some of our customers were asking for it, and we were finding many of the the reusable launderable gowns, which came through aid to hospitals, that when it went to the labs, they were being discarded in the trash. And so we weren't able to reverse that for whatever reason. And so we've been exploring this alternative, and really thank you for your presentation.
No, thank you for that, yeah. And then you had
Are the gowns, reusable gowns, are they cleaned on site or do they have to be shipped?
I believe they're cleaned on site.
No, they get shipped off from aid to hospitals.
I didn't know that. Is that added expense?
So that was considered an environmental cost as it relates to transporting them.
Yes.
With all of the reusable stuff, do we have any idea how much of it, or sorry, the recyclable stuff, do we have any idea how much of it is actually recyclable when we're dealing with like animal waste contaminating?
So I think after the first, 6 to 8 weeks, we'd already diverted 17,000 pounds. Was that the number?
Yeah, yes, you're right.
Yeah.
You're absolutely right.
So it is being an effective recycling program, yes. Yes. The point being, though, just that if we can eliminate the need for the waste in the first place, that would reduce the cost as well, or reduce the amount of waste that's going to the landfill. But I am happy that we are able to recycle the material as it is. Yes.
It's nice that we have the recyclable gowns, because sometimes the reusable ones, they look pretty ratty. But can you, on your personal experience, can you tell me how many times a day you might enter the mouse room? So how many gowns would you use a day compared to the reusable one?
So even with the reusable one, you're still, taking it on, taking it off. So the number of uses per day would be the same either way. But in any given day, I'll probably go down at least once every other day, just as kind of general maintenance of mice. If you're doing an experiment, people will go down anywhere from, like daily to multiple times a day, just depending on, exactly how many. Or, when you get down to the vivarium and you realize, oh shoot, I left, my pen, or I ran out of drug, or, something like that, then you end up going back up and coming back down. So, I mean, it's been not uncommon to have maybe 5 times in any given day to end up back down in the vivarium.
So for individuals who do repeated returns to their room in a day, the reusable gowns are no longer cost effective because you only get one use.
For the reusable?
I mean for the recyclable ones. They're no longer cost effective if you're going to the vivarium multiple times a day because you have to discard them.
Yes.
I just have a curiosity question. The idea of the paper bag, because you can't cover the cages, that was something to me like, oh my goodness, that would be a difficult thing to think about. In the Journal of Infectious Control, did they include that? Is that something that's just common in Rochester? Or
wasn't something that was at least in the paper that was doing the study. But they were also looking to, in terms of like medical facilities, so more in terms of, like scrubs for a hospital and not necessarily thinking about the animal.
Yeah, because the paper bag thing seemed like a surprise, but something that needed to be considered.
Something. But
Would it be helpful to implement like a reusable gown recycling area per level of the hospital where they have access to the vivarium? So each floor would get a carton where you can shove your reusable gowns after you're done with your mice work. So that way you get increased people returning them instead of throwing them away. If there's actually a spot where they can just go and deposit it. That might be something to think about for the university.
I think that's an idea to explore. I mean, as it stands now, it should be pretty straightforward for people to return their reusable gowns, considering it's in the same location that you return the cages. But yeah, that would definitely be something to consider. Yeah.
More of a curiosity question. So you talked about the booties. It's been a long time since I've been to Vivarium. Are there reusable booties?
Are there reusable
gloves, booties, and book covers?
The shoe covers, I don't know if there are currently reusable options, but they've also, at least in the KMRB, have switched to just a mat, like kind of like a sticky mat almost, where we don't need to use them at all. Yeah.
All right, let's take our speakers.
So good morning, I'm Madison Armstrong. I'm currently a prep scholar, so I'm a post-bac student within the Department of Environmental Medicine.
And I'm Ashley Fields. I'm a fourth-year toxicology student within the Department of Environmental Medicine. And today we're going to talk about improving Rochester City School District's academic performance and graduation rates. And this will be addressed to the University of Rochester and RCSD. The issue at hand is RCSD has the lowest academic performance and graduation rates in New York State. The overall graduation rate is about 50%. However, there are schools that have even lower rates. This means there's a large need for additional support for academic programs for these students. And the University of Rochester can actually be this additional support by having graduate students volunteer their times at these schools. So as you can see here, RCSD is significantly underperforming compared to the rest of New York State. On the left, you can see that this is an example of grade 8 English language arts, and RCSD both in 2018 and 2019 had significantly lower rate proficiency levels compared to New York State. And it's even more significant when you look at the grade 8 mathematics assessment. This has deemed Rochester City schools as persistently failing, and they are in dire need of academic support. However, RCSD has a current massive budget deficit of $30 million, and this budget deficit will continue to grow if there's no additional actions taken. Superintendent Terry Dadd has proposed a plan that's intended to reduce the staff, which means 168 teachers and 38 teaching assistants will be fired. And this is being voted on December 19th, meaning this will take action in the middle of a school year, causing a high disruption in the learning environment, meaning now more than ever, RCSD needs this academic support. Mayor Warren actually proposed that New York State should take over RCSD, and this can be made possible through the Education Transformation Act of 2015, where New York State can take over persistently failing schools such as RCSD, but RCSD is a school district. This will be highly expensive, upwards of $100 million for a district takeover. And there's actually no findings that support that state-run schools improve educational outcomes. Actually, it creates a disrupted educational learning environment because many of the times when the state takes over a school, there's massive staff cuts.
So in lieu of doing a state-run takeover, we are proposing a local, no extra cost option by having the University of Rochester allow graduate students to volunteer at these schools. These graduate students will be able to provide before and after school tutoring, as well as guest lectures and topics they're well familiar with, and functioning as lab and teaching aids. This program is focused on providing an engaging, culturally relevant curriculum for these students, as well as an additional set of role models to encourage positive behavior. The University of Rochester is actually already an educational partnership organization, or an EPO, with East High, which is a local high school here. This is a potential foundation for providing this academic assistance within the short term. So the benefits and aims for students who are the biggest concern for this group, as it is their future that is on the line. For high school students, we hope that this program will improve attendance and performance in schools. By providing an engaging curriculum and labs that mean something more to them, we hope that this will encourage them to come to school more often and to be engaged within class. We also think that this program will help to decrease substance abuse and delinquencies with this additional set of role models who are showing them that there's a better social foundation that they can come to if they have any sorts of issues. Also, it increases morale and self-confidence. If these students are doing better academically and have that social foundation, they'll feel not only better about themselves, but about their future. As well as benefits for University of Rochester graduate students, they'll gain experience in mentoring. A lot of students are interested in academia-related careers, and so this teaching experience would also help them in the future. They'll also be showing that they can present complex topics to the public and break them down into more understandable components. By providing assistance to the community, they'll also be helping to improve the future of Rochester. Again, graduate students are interested in outreach, and these sorts of opportunities would be good in a program like this. There are also benefits for the district and university themselves. So for Rochester City School District, this would help improve the graduation rates and the academic performance, hopefully to the extent that it would reduce the categorization that New York State has placed and that they are a persistently failing school. This would also benefit the University of Rochester in that they would be able to provide additional experience for their graduate students, both inside and out of the classroom, as well as providing experience for those who are interested in both academia and industry-related careers. This would also potentially increase the number of students who are interested in higher education, and those students may even potentially want to come to the University of Rochester. Again, they would be providing assistance to the community and improving the future of Rochester, which the university has shown interest in through programs like the Life Sciences Learning Center and public health outreach. So our main recommendation is to allow graduate students within the University of Rochester to volunteer at these schools to provide academic support. We suggest to start with East High School, as there is already a partnership within the University of Rochester with them, and these services provided would include tutoring, guest lectures, and potentially curricula design. We also suggest that all parties involved, including the teachers, high school students, and graduate students, participate in regular evaluations. This is to make sure that the benefits are being distributed equally, as well as to field suggestions for future iterations. So to conclude all of that and summarize, Rochester City School District is currently identified as persistently failing by New York State, and this is due to low graduation rates and academic performance. In addition to that, there is a financial crisis in which there's going to be a potential loss of teachers and teaching assistants. This can be assisted by the University of Rochester utilizing the EPO they currently have with East High as a short-term option to allow graduate students to volunteer providing academic assistance. This would benefit both graduate students and high school students by providing experience within the classroom, as well as increasing the high school students' pool of mentors and role models. I guess now we'll field any questions regarding the policy or our presentation.
We'll go Cindy first. Are you aware of any other programs that do something similar to this, where having graduate students in high schools acting as lab assistants or as guest lecturers?
Through the life science learning community, graduate students can volunteer to be to work there, and they can go out to the schools and host labs, or schools will come to us and we can host labs. But there's nothing that's really a full, well-rounded academic support system. In the back.
Maybe I can ask the suggestion. So currently a lot of graduate students already volunteer in the free time, but it's not like there's really any benefit to you. Just kind of do it out of the goodness of your heart. But I think one suggestion would be for people to be able to fulfill their TA requirement by creating a curriculum and doing guest lectures at these high schools, so that you can increase that presence at the Rochester City schools, but also there would be a benefit to the students outside of taking them in class.
Yeah, we appreciate the suggestion, and also I'm not sure if you guys are aware, if you are interested in academia, there are limited teaching opportunities at the university, and they fill up quickly, and you don't actually get to necessarily teach or lead your own workshop all the time. And also, if you reach out to other universities, they'll be like, sorry, we cannot allow you to be at our university because we can't pay you, because a lot of us are supported by NIH grants, so we can't have outside money. So this would help give us more resources for teaching and build our CVs up for academia, but also fill the TA requirements. Jeff.
Do you know how the city school teachers feel about this proposal?
Is it about the Terry Dad's proposal about cutting staff? Because they just had a protest. They don't want to lose their jobs. So if we could figure out we can't figure out the budget deficit problem, but I think maybe teachers might appreciate having some extra help because they are going to lose lots of teaching aides. They actually might eliminate all teaching aides because they're going to be redundant in the classroom. But we can also help provide engaging curricula ideas for them.
One of the, I think, getting to his point, one of the issues that you're going to run into is you're essentially replacing, and it's a well-intentioned proposal, but you're replacing, unionized, trained, with benefits, teachers that are public employees with a pension and everything that are going to be laid off because of the crisis that you state, and the crisis that you state at the start isn't necessarily solved by this. It might help the students, right? So if you're looking at it from the perspective of the students, it might be great to have what I'm sure are very qualified grad students, but for the teaching profession, it could sort of be a slippery slope into other districts looking to see cost savings by eliminating teaching and teaching aid positions in favor of the sort of like free labor from universities.
I can understand where you're coming from with that. And honestly, we don't want to overstep onto teachers. They went through their schooling and they provide very good foundations for the classrooms. For example, when University of Rochester built this EPO with East High, University of Rochester helped build this structure, but it was really the teachers who helped the students perform academically. But because we're in this budget deficit and we're going to lose a lot of teachers, I don't think it's going to hurt having students come in and help, because we're not going to be able to avoid this budget deficit, but for the sake of the future of the students, we can volunteer as graduate students to help out.
I think the main problem that we're trying to address is mostly the academic performance and graduation rates. The budget deficit is just something that's making that worse, I guess.
Yeah.
So how many graduate students do you think would be required to have the impact on the outcomes you listed? Do you have a sense of that?
I don't think we have a specific number per se, but I think the lowest scoring were the English and language arts as well as mathematics. I know that science currently is the highest scoring area for these students, but across the board it's completely below the New York State average. So in all fields of all graduate students, they would be useful for these teachers.
And also, if this opportunity does arise, I think we can grab attention of a lot of graduate students, because we can utilize UR Best to advertise these opportunities that didn't exist before, but now they were to exist. But if we're starting with just a single school, we maybe don't need as many graduate students, but when you start branching out through the districts, we might have to partner with other universities to bring students in.
Elaine?
So I really like, I think the point of retention and graduation and student serving role models, right? Because near peer, closer age, sometimes you identify better. It's a really good point. But is there any literature statistics on the evidence for decreased substance abuse? Is there any evidence of that, or there's just hopefully a well-anticipated outcome of that, or is there data for that?
So for state takeover schools, they do, they look at like decreased substance abuse with those schools. but they actually didn't see any changes. But when U of R and East High formed their EPO, they saw that there was a decrease in delinquencies, substance abuse, in-school suspensions, out-of-school suspensions. Like overall, the culture of the school had changed. So, but for graduate students actually helping, there's actually really no statistics on that part. All the way in the back.
Yeah, so the Rochester City School, the classes statistic I heard, around half of the families suffer from poverty. That brings along a lot of trauma, a lot of incarcerated parents, or single parent living in homes. There's also a lot of cultural and race differences between the population of the UR graduate population and the UR SPI population. So how do you plan on training or preparing this graduate student group to handle the kinds of traumas that they might have experienced?
Good question. That's a very good question, and it's a point that we hadn't considered. We do know that graduate students receive, at least I did when I came there, they receive a bit of training in terms of ethics and bias and those sorts of things as well. I'm sure that similar program, I think it's, what is it,
I'm not sure, but
the name of the program that you receive your initial graduate training, I think that they also have potential like counseling training programs as well that you could enroll those students in. It would certainly be something to look into because that is a very good point.
And the University of Rochester mandates that everybody takes a discrimination, unconscious bias, like online course, so they can help with some of those parts. But when you're talking about like incarcerated parents or maybe disruptive family homes, we might need like university services like the counseling center to help graduate students navigate ways if they come across that. Tracy?
The other thing, which I don't know a lot about, but at Warner, they've got a lot of doctoral students that are doing education and counseling. So you might even team up a science person or a math person with one of these counseling doctoral students. So that way you've got a team, graduate student team.
Yeah, that's true. And also Warner is also the one who puts together all the reports about University of Rochester and East High's EPO, and it is very detailed, and they talk about a lot of the things they've come across.
I just met some really interesting counseling doctoral students, and I thought they would be really interested in
Yeah.
Thank you.
Hi, my name is Ken Quinn. I'm a PhD candidate in biomedical engineering, and today I'd like to advocate to the New York State Senate Standing Committee on Environmental Conservation about mitigating damage to the natural resources in the Adirondack Park. So the Adirondack Park is the largest publicly protected area in the contiguous United States. It's enshrined in the New York State Constitution to be kept forever wild. It's home to 132,000 residents, but not only that, it receives 10 million tourists annually who contribute upwards of $1.1 billion to what would otherwise be small, isolated communities. And people come here to do all sorts of things, including hiking, water sports like canoeing, boating, rafting, or they can just gaze at the natural beauty or enjoy the stars away from the hustle and bustle of real life. So located in the Adirondack Park is the High Peaks Wilderness region. It's probably one of the most visited regions in the park. As its name suggests, it contains the highest peaks as well as the most difficult hiking trails in the state, many of them topped with very rare, fragile alpine vegetation. And so many people like to conquer all these peaks. And as a result, it's become very popular amongst hikers. So popular, in fact, that these trails have seen an exponential increase in usage within just the past decade, as shown here by graphs of trail registrations. And so, at first glance, we should be ecstatic that people are looking to northern New York, the Adirondacks, as a vacation spot to enjoy the scenery, the wilderness. But this popularity has come at a cost. Namely, the degradation of the local ecosystem. Since people are hiking on poorly designed trails, this causes erosion and damages the vegetation. And the current trail maintenance practices really inadequately combat this erosion. And finally, especially with some of the more novice hikers, since it's getting more popular, poor trail etiquette really just pollutes these precious water supplies. So this is a map of trails in the High Peaks region, and these are essentially the same as they were built 100 years ago when people first wanted to hike up these mountains. And it was when principles of sustainable trail design were really not known. So the colors here show the different slopes going up and down these mountains. And we see a lot of orange and red, which means the trails are really just too steep here because, well, people just wanted to go straight up the mountain. So let's pick the shortest point. And then you might see like occasional patches of green, which means those are the places that are really flat. What does this really mean though? So when it rains or the snow melts, all that water just rushes down and gouges those trails, and then down to those rare green patches where the water pools. So this, first of all, erodes these trails, exemplified in the picture on the left. But furthermore, it encourages people to avoid muddy boots and muddy lunches to hike around these trails. So what they'll do is they'll create little herd paths, just climb over through the vegetation that's native to the area. So in the image of the right, you see there's like the little path there people are making. And this really just, then this off-trail behavior really just exacerbates that erosion problem and damages those rare species. Let's see. So based on these drainage issues and exacerbated by the poor trail design, the Adirondack Council has identified approximately 130 miles of trails in significant need of redesign. And not just to fix these problems, but also to actually correct and prevent the further damage. So how is trail maintenance done right now? Well, the trail maintenance is contracted by the DEC to advocacy and recreation groups who send mostly volunteers. Unfortunately, these volunteers lack really training in sustainable trail design. So they can their work can slow down the rate of erosion, but really it doesn't address the larger issue of prevention. Furthermore, because they're poorly funded, trail crews take usually 20 to 25 weeks to fix 1 mile of trail, which means we need a lifetime to fix the other 129. And then finally, more hikers means more trash. The main principle you're taught when you're a novice hiker is carry in, carry out, which means no littering. And if you're dealing with waste, if you have to poop in the middle of the trail, you're supposed to dig a hole, poop in it, bury it, and away from water sources. And improperly disposed poop and trash contaminates the water supply. It leaches into waterways, and the waterways that people use for drinking and recreation. So, and in fact, the pretty pictures I showed at the beginning, it turns out that pretty much all the water supplies in the Adirondacks are actually contaminated and unsafe for drinking. So how do we save the Adirondacks? Well, we can first look at programs to regulate the numbers of hikers who hike these trails through a license program with a fee. And then we can use these fees to increase educational opportunities, such as through Summit Steward programs, and then also employ full-time trail maintenance teams to reroute and rebuild these trails. So my first suggestion is to implement the license program. But if we issue, say, monthly license, we can limit the trail use of the most popular trails, encourage hikers to explore really the hundreds of other trails and activities, especially ones outside the high peaks. And I think this also fosters kind of a sense of the community responsibility to take care of these resources, because we can especially because we can use some of the funds raised here to target, to use them for education programs as well as conservation. One being the Summit Stewards. Since 1990, they've been run by the Adirondack Mountain Club, which is an organization, a nonprofit dedicated to conservation and preservation in the region. So this program specifically, the Summit Stewards interact with hikers and educate them on the fragile ecosystems and conduct alpine research, as well as talk to people about best trail practices, what to do and what not to do while they're hiking, especially for those novice hikers. And I think these two photos are a testament to their success, showing before the program was implemented and after, educating the 500,000 they've already interacted with, how the greenery has all come back and people can very much enjoy them. So right now, from the most popular trailhead, the 80K Lodge, there's stewards on 4 of these peaks, but I would argue that at least about 16 of these peaks could be reached in a day, that are just as popular as the ones that they're stationed on right now. So I propose that the stewards should, at least across the High Peaks region, should be stationed at least 10 more of these peaks. And then my final proposal would be to employ teams of professionals, including environmental scientists, geologists, and civil engineers, who can use their scientific and technological expertise to tackle trail building systematically. For example, they can use GIS data to assess topography, know how to route trails based on soil composition and erosion factors, or just route waterways that drive to rivers and streams. And we really need a dedicated team that can create these short and long-term goals, set milestones, and assess progress rather than the patchwork method that the volunteers are doing right now, which really, to no fault of their own, they just don't have the ability or the foresight to create these longer-term visions and goals. So my recommendations for the Adirondacks, well, it's home to one of the state's most vibrant natural resources, and I think we're very much all obligated to take better care of it. So I implore the state to take a more modern, well-funded approach to regulate the usage of the park, and foster in visitors a sense of the collective responsibility to protect these resources and implement the modern technologies, not just to maintain, but to build the trails that prevent damage to the waterways, the ecosystems, so we can enjoy the unblemished beauty for generations to come. Thank you very much.
So with the, there's sort of like in my world, like 2 types of people that would go to the Adirondacks, right? There's the tourists that are going for some reason, then there's like the 46ers who go because it's like part of their lifestyle. It seems like if you're trying to raise revenue for it, how did you come to the conclusion of like a monthly license or something like that versus just like an entry fee like at any other park? Because it seems like if you have to sort of apply for some sort of license or subscription or something, that sort of means you're a regular versus, that 7 to 10 million tourists could go down significantly. So versus like an entry fee like they have in other parks.
Right. So my proposal, we would implement these licenses for the most popular trailheads. So that's how one way to regulate the use of those areas there. Also, licensed programs have already been implemented in a lot of the national parks along the Appalachian Trail, with great success with regulating the numbers of people who are going to these parks. So it's not, I wouldn't say it's a limitation. And also, if people can't necessarily get to the trails they want, the state can also do advertising campaigns, which they've done in the past for the Adirondacks, to get people to go to these other places. Do you have a question?
What should you have estimate for the, so you're recommending all 3?
Yeah.
Okay. So with the summer steward program, what would be, who would that go to the DEC and what's the cost for that?
Right, so I mean, the DEC does have partnerships with a lot of these nonprofit organizations already, including the Adirondack Mountain Club. So this would just be another part of their partnership.
Any sense of cost for that?
Well, so the cost issue is a little bit controversial because so one of the ways we can assess all of these costs is with the Adirondack Park Agency, which is a subset of the DEC. Now, Governor Cuomo has been a little bit slow in in appointing some of these board members. So and these guys have the power to do these long-term cost analyses, but it's just unfortunate barrier to answering that question.
With the Adirondack Mountain Club, you say that they are actually working on things now, but they are kind of constrained by long-term vision. Are you sure it's not by their money as opposed to long-term vision?
I mean, that is also another factor. I did mention that these, like the trail crews, for example, are also very underfunded. I mean, most of the people working on these trails are volunteers anyway, so they're not getting paid really anything.
And with the Mountain Club, where do they get their money when they are out there already?
A lot of it comes from private donors. A lot from, say, outdoor companies like Patagonia, Outdoor Research, those sorts of private enterprises.
And then I have a question which you may or may not be able to answer. I'm familiar with fishing licenses. The idea is when people go fishing, so I think it'd be comparable to hiking. But why, like he asked, why not a ticket into the park? Is there one reason? Why do they like the licenses? Yeah.
Well, I think with monthly license that one, it eases people into the process of getting a license, and it gives people a little bit more flexibility in terms of planning their vacations. Like if you just say that I'm going to buy a license for one day and then you break a leg or something. Well, we want to keep tourists happy as well, because you ultimately don't want to detract people away from these sparse populations.
And with the fishing, you have people that already stopped at lakes, so I always thought, well, that's a great thing. But yeah, I didn't know about Friday.
So you started your talk by pointing out that it's in the state's constitution.
Sorry, I can't.
You started your talk by pointing out that it's in the state constitution that this land be kept wild, and concluded your talk by saying you felt that the state had a responsibility to keep the land wild. Do you think that means the state is legally obliged to do something about this catastrophe you pointed out?
I mean, if it's enshrined in the Constitution, then yes.
So you think you can assume that they don't?
You can
assume that they don't?
It's a little problematic there. I mean, if the state also, well, they don't run the courts, but we can't speak to biases there. That's really all I'll say on that.
From a public health and water hygiene risk, have you come up with an alternative to leaving your feces in the park?
I mean, some people do advocate for that, but if you just leave your poop on the surface or on a trail, then yeah, it's gonna get in the water right away. But when you dig a hole and bury it, then it has time to decompose because the runoff water does not necessarily get to the poop first; it gets to the soil first. And they're also at some of the most popular trailheads. There are also latrines that people are allowed to use, but they smell it.
Thank you for that. I know that some might, when they go off trail to find a place, would be further disruptive to the park, find their own private spot.
Sure.
So interesting risk.
Yeah, I mean that. Yeah, it's kind of like if you go off trail, yes, that does create the erosion, but also you can't just pollute everyone's drinking water.
Thank you.
It's an easy question.
I was wondering, related kind of to that, what specifically is the water contaminated with? And also a bit of a follow-up question, do you have any idea of the rates of what the wildlife has, since the wildlife is obviously not digging holes and burying its feces afterwards? Like I know like giardia is a major issue in some areas,
Right, yeah.
and raccoons will pick that up and just carry it all over the place. So would there be any plans to like help with animals that are infected?
But helping animals that are affected. Okay.
Sorry, first thing is just like, what is the water contaminated with?
Things in the food, so. that will lead to diseases, hepatitis, as mentioned. Sorry. Yeah, all sorts of bacteria and viruses. I mean, if it's bacteria and viruses that affect humans, then yeah, poop from humans is going to affect humans. At least from my basic understanding of virology. And then in terms of health, so what was the second question?
Sorry, the second question was, a lot of diseases can carry from humans to animals. So say if you get with the issue of like water contamination, but you still have a raccoon population that's infected or other animals, what would you see doing about that?
That's a good question.
You can stop people, but it's harder to stop animals.
I don't have a good answer for that.
Yeah.
But I suspect that, say, we could talk to the Adirondack Council, because they're a nonprofit there who funds this type of research. That could be a problem that we could bring to them and further explore.
Let's thank our speakers.
So everyone, we added up our totals. It should first be noted that all of them were very close, actually. So all of them came between a score of 75 and 88. So first of all, everybody should be really pleased. I was a political science major. I'm really impressed with what you guys put together. And it's not my first time here. I came to talk science and policy, and I'm just very impressed by it. I couldn't talk the level of science that you guys talk about policy, so I'm very impressed by what you guys are doing. But for the suspense, I'll go from third to first. So third place, Nicholas Battaglia. Second place, Janelle Beasy. And first place, Sydney Simpson.
Thank you so much. Wow.
Thank you guys all for coming, participating, and I can see everybody put in their memo.